Hi, my name is Trinity Oseguera, and today I'm talking about the effects and causes of depression. So first is the history on it. Depression was originally known as melancholia, which was discovered around the medieval period. It was a much more open theory back then, with symptoms including sadness, fear, anger, and even some delusions. But then around the mid 20th century, melancholia was more understood as a chemical imbalance in the brain. However, eventually these ideas were found at fault because they didn't consider the personal and social context in which depression can occur. And then next we have the causes of depression. And depression is like a really difficult disease, and it can be caused by many different reasons, depending on the person. But some of the main causes of it can be abuse, age, certain medications that can make you feel off, and then they can cause you to become depressed. Conflict with family or friends, maybe there's fights going on in the family or arguments or whatever. Death or loss, if you lose an important person in your life, you can fall into depression. And major events, like even happy things like graduation or moving into a new house, can cause depression. And then certain illnesses can cause it as well. And then next we have the symptoms. They can vary for everyone, but again, some of the most common ones include feelings of hopelessness and unbearable sadness, frustration, the loss of interest in daily activities, especially ones that people used to like. If they like to ride their bike a lot before or talk with friends and they're not doing that anymore, then that can be like an easy tell of someone who's falling into depression. Lack of energy, weight loss, reduced appetite, anxiety, feelings of guilt or self-blame, blaming yourself, and then insomnia, not being able to sleep at night or maybe sleeping all day, and then suicidal thoughts. And then we have treatments. There aren't really many options other than medication, which I know a lot of people might not be interested in, or interested in taking other medication that can cause other symptoms, but you can also do therapy. Seeing someone and talking to someone about what you're going through can help a lot. But yeah. And then next we have how it affects people in their daily life. It can cause a lot of pain throughout the day because you can't really focus on anything. You're losing interest in all activities, so getting work done at your work or at school can be really hard. You might not be able to focus. You might also struggle with doing your normal hygienic tasks, like brushing your teeth or showering, or those kinds of things can be really hard. It might be hard to get yourself out of bed in the morning, or even throughout the day. Like I said, you could just kind of be sleeping all day, not feeling like putting any energy into anything. Eating or drinking, fatigue. You might be struggling with having appetite to even eat anything. And then staying in contact with your friends and family. Like I said, if you're losing interest of being able to talk with family that you used to normally talk to, yeah, you might not feel like talking to anybody and just keeping to yourself. And it just really affects your productivity throughout the day. And then these are my sources. But yeah, that's the effects and the causes of depression.